Dr. Elizabeth Boham is a functional medicine specialist, medical director at Ultra Wellness Center, and author of Breast Wellness and a breast cancer survivor. Welcome, Liz.
Thank you.
Come on up. So you were on mute, so we want to just take that off of mute. Let me take my little chimes down there.
Do I want to be low or high?
Oh, we're gonna go high.
Okay.
Twyla would be proud of us, right?
I will.
She likes it when we make a lot of noise. Anyway, so if you can't hear, now's a good time to pull up, to move your seat up. But anyway, so this is a crazy story. I'm going to tell it really fast. So Kathy, raise your hands. Okay, we are here because of Kathy.
Yes.
Because I was attending a different workshop at Kripalu up in Massachusetts, and the pipes burst in the middle of the night, and I ended up at 3 o'clock in the morning at a hotel, delirious. At 6 o'clock in the morning, I got up to go home, and I was in the hotel lobby like a zombie. And there's Kathy with her smiling little face, and she said, "Oh, were you attending a Kripalu workshop?" And I was like, "Yeah, like, were you not there?" She goes, "No, I stayed in a hotel." I was like, "Very good idea." You got sleep, I didn't. And she said, "Yeah, I was doing the boosting your immune workshop." And I was like, "I was not. I was doing this tapping thing," which that's another story. But anyway, so she's like, what do you need?" I said, "Oat milk." She said, "I have 2. And so I was like, "You are my queen." So anyway, we fell in love over oat milk in the lobby of a hotel in Massachusetts. But when we had dinner later on, she ended up telling me about Liz and about how Liz really changed her life. And Liz is the doctor that we all dream of having. She was a patient herself. She continues to remember what it was like to be a patient, especially during a very scary time in her life. She helps you connect the dots. Surprise, surprise, we've got lots of different doctors and no one's talking to each other. Anybody ever go through that? Anybody feel that you're just out to see yourself? Exactly. Well, Liz is here to be the sane voice of reason and medical care. But, so just give us a little, just tell us about your journey in terms of what happened with your scare very early on and kind of how it brought you to where the medicine that you practice so beautifully.
Absolutely. Well, it's great to be here. Thank you, Ann. Am I on? I think so. Yes. It's great to be with you all. This is really fun and in this beautiful view. Oh my goodness. So I was in medical. I was actually in my residency training program. Actually, I'll back up one more second. My undergraduate and graduate degree was in nutrition and exercise physiology. So I was really interested in wellness and prevention. And then I said, well, maybe I should go to medical school so I can learn more about health and how the body works. And nobody in my family were physicians, so I really had no idea what I was getting into. And so I got into medical school, and I'm like, oh, we're not really doing how the body works and wellness. It was so
or any nutrition at all.
No nutrition, but it was a lot about acute care medicine, which I just wasn't ready for. I just didn't realize. And so I struggled a little bit throughout the training program for a bunch of reasons. And I was in residency, and I was doing breast self-exams because I was trying to learn how to do breast exams on my patients. And July of 1999, I didn't, everything felt fine to me. And then August 1999, I found a lump, and I didn't have any family history of breast cancer. I was 30 years old, and I was like, I didn't think it was anything, but my husband's like, you should get that checked out. Well, lo and behold, I had a triple negative breast cancer and, aggressive and blah, 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 blah. So I had to do, the surgery and then the chemo and then the radiation. And then I was so focused on wanting to have children. And so a few months after I went through the treatment, my period came back, because it went away with the chemo. My period came back. And a few months later, I was pregnant with Amma. And then was able to breastfeed on the non-radiated breast, and then got pregnant with my son, who's 23. We can clap for him too, but you don't have to. And then I was like, oh my goodness, when once they were born, and I was all of a sudden it sort of hit me like, oh, okay, that just happened to me. I just went through cancer at 30 with no family history, and I thought I was taking care of myself, and then I was exhausted because I had 2 little kids, and I just had finished all this treatment, and I kind of realized I was like, I have to figure out how to do this all differently. I need to figure out how to take care of myself, but also I wanted to figure out how to take care of my patients in a different way. And I wasn't happy with how, my training was putting me forward to practice medicine. And I was like, I want to do this differently. And I got really lucky. I got a job at Canyon Ranch in Lenox, Massachusetts, and I ended up meeting Mark Hyman and Cindy Geyer and Kathy Swift and Todd Lapine and all these people that
These are icons
all
in
work
the
with.
kind of, if anybody, in the ultra wellness.
Yeah, and so, and I went to a functional medicine conference, and it was my first one, and I was like blown away. I was like, this is amazing. This is how I want to practice medicine. This is going to bring together my nutrition background with my conventional medicine training and give me the tools, the map, to be able to do this in a different way.
How would you define functional medicine? Why is that like?
Absolutely. So functional medicine is, well, we say it's just good medicine, but really it's a different way of thinking about things. So in conventional medicine, when we went through training, the focus was on, okay, let's name what's going on and then suppress the symptoms. And that way of thinking is really, really important for acute care medicine. So when somebody is coming into the ER because they have an asthma exacerbation, right? They can't breathe. You need to name what's going on and treat it right away. And that's really important. And we do acute care medicine pretty well, right? But what we've done in conventional medicine is we've taken that way of thinking and then applied it to chronic disease management, or what we call healthcare, but it's not really healthcare, right? And that just doesn't work well, because what happens is somebody comes in with asthma or whatever, and so then they just name the disease, right? And then you have a protocol of what the treatment should be. But what functional medicine says is, well, why is that person having asthma, right? And because if we can, it's not like you can always figure out why. I think that, but when you ask the question why, you think about it differently. Mm-hmm. You don't just focus on suppressing the symptoms, you go upstream and say, well, what's going on with this person? And try to connect the dots, really get a really good detailed history of their situation and understand what's out of balance for them and for their body, and how can we help them create better balance in their health, and how can we help them create health for themselves. And so it's really looking upstream, asking that question, why, really, of course, using science, using individual, really dealing with that patient as an individual. So working to treat the patient and not just the disease you're dealing with. And so I was just blown away. I'm like, this is how I want to practice medicine, and so it made me feel, okay, this, and it also helped me. Not only make me feel like, okay, this is fun, I want to practice medicine this way, but it also helped me understand about myself, right? So, if I always use this example, if you had 10 people who had breast cancer, you may have 10 different reasons for why they had breast cancer. And so even if the treatment is very similar, the things that got out of balance are very different. And so you have to work for that each person to help them create their balance for them. And so it helped me really understand, because I thought I was doing everything right? I was eating the right foods, I was exercising, but I was out of balance, and I had to figure out how to help my body get into better balance again.
Right. And also the part of it, which is what we said, which was like shit happens, right?
Right.
Also, there's that part, right?
Yes,
And it's
absolutely.
really hard. I mean, it's really hard. And you were talking about, and again, I want to go back because I want to talk about breast cancer. But one of the things that's important that anytime anybody's had a health scare, you were talking about having to learn to trust your body again.
Yeah.
You know, like being so blindsided, like I'm doing everything right. We talked about during a Heart Health Month, the cardiologist was saying oftentimes women with heart disease blame themselves, like, oh, I had a heart attack, but like that's because I didn't exercise enough or I didn't eat the right food. Like there's a lot of blame. Cancer, sometimes not so much, but still, like what went wrong with my body? So it took time for you to just trust your body again and not be afraid of maybe another shoe dropping, right?
Yeah, I feel like because I was so focused on prevention and wellness, and when I came out with this breast wellness book, and we can talk, but I wanted to give women the tools to feel empowered that there was things that they could do that could decrease their risk. But something that Amma and I talked about a lot was we want to put it in a way where people don't feel like they're being blamed or like I did something wrong, right? Because, like you said, because shit happens,
right.
And so you want to have some tools and that empowerment to make some shifts that you feel like you need to make, but not feel like, oh, this was my fault,
right?
Exactly. And so that was something I really wanted to get across in the book, and something we talked a lot about.
This is so cool. This is a very cool part of the story. So she didn't ever think, you're going through breast cancer, you're going to have all this chemo. It's like, will I ever have children, right? She really wanted to have kids. And so tell what happened with your book.
I did the DVD like in 2015. I did a DVD about breast wellness, and really what it's about is that functional medicine approach to how we think about our breast health. So from a functional medicine perspective, how do we approach a patient to create optimal health in their body and breast health, right? So, and then a couple of years ago, I was like, it's getting outdated. Nobody has DVD players anymore. And I said to Amma, I want to take all this information and update
Always ask
it.
the young people, right?
Yeah.
You're like, what do I do? How do I do this?
And I want to update it.
I know I didn't push that button.
Yeah, you pushed the button. So, and Amma's a beautiful writer. So she helped me take some of the information from the book, and then we updated it with new research, and then she helped me write it in a way that
How cool is that?
Yeah.
That the daughter that you were really just like wished that you would have ends up writing the book about the breast cancer. I think that's just so cool. It's so cool. So let me circle back. I just want to ask some statistics. So is it 1 out of 33 women dies of breast cancer, or is it higher?
Yeah, it's right around out of 1 or 33, 34, right around there. Yep.
Right. And so, because we would talk about heart disease, and we're saying like 1 out of 3 women, but people are going for their mammogram. So, just with the stats, should we once a year be getting a mammogram?
So, I think screening. The general recommendations are 45 to 75 every other year, but then you really want to be getting a mammogram, but you want to be speaking with your physician to come up with your personal recommendations. The issues with mammography is it's better for older breast tissue. So it works.
That would be me.
It works. It doesn't work. Mammography doesn't work as well with the younger, denser breast tissue, and so and also dense breast tissue. So I really believe we need some better screening as well.
So you do mammogram, but then sonogram, because sonogram will see with dense breasts.
Yep.
These will all see different things. So you can have a sonogram and it doesn't show something that a mammogram would,
Absolutely.
and vice versa.
They look at it very differently. And now there's some newer screening tests that are coming out. I'm kind of excited about QT imaging. It's a type of an ultrasound.
Wait, hold on 1 second.
Yeah.
I forgot to tell you, on your table, there are pads and there's pens. you can take them home, the Annie Gets It Done pads, but write whatever you need on there, because if you're putting it on your phone, I think that you're not paying attention. And so if you can use that to write these things down. Sorry, go ahead.
So it's a QT imaging. It's a newer technology where it's like an ultrasound. It is an ultrasound technology.
So no radiation.
Exactly, no radiation. But it doesn't. You lay on a table, so there's not a technician
Squeezing.
or even just rolling the. So
It's like everything fine? Oh,
Yeah.
that's fine. Yeah, it's fine.
and screening is really important. And I put in the category of screening, right, is your breast self-exam, getting to know your own breast tissue. If you see something different or notice something different, talk to people, because
Who
screening.
does it once a month? You good. Because when you were talking about that, I just realized that I never do it. There is a card that that you can put in your shower that a lot of
Yes.
people have that reminds you. So maybe what I'm going to do, and Caitlin is not here hearing this, but maybe she is, I'm going to buy those for you. So next time you come, it's going to be hanging in your shower. It'll remind you.
You know, and so that's like, that's early detection, and early detection is great. It saves lives, it saves mine. It is, it is wonderful. But we also want to think about, prevention.
Exactly.
And so often when women think I'm preventing breast cancer, I'm getting my screening, but that's not necessarily prevention. And so what we want to talk about is what else can we do to try to decrease risk.
Right. So what would you say, kind of, and again, this is like again, we've already talked about the matrix of how many things play in to any kind of disease. But number one seems to be inflammation.
Yeah.
And so, again, we have so little time, but I want to be able to. Inflammation just seems to be this kind of vague word about you shouldn't have inflammation, right? Mm-hmm. So we were talking earlier, some inflammation is good, but it's the chronic inflammation that is bad. So explain what the signs of chronic inflammation might be.
Yes. So we know that cancer likes to grow when there's either in the face of local inflammation or a lot of inflammation in the body. And so there's a lot of different causes for inflammation. And as Ann was saying, it's not just like having a little inflammation after you get injured, it's this long-standing chronic inflammation that's the issue. And for some people, it may be digestive issues, maybe a symptom, somebody else holding on to water or fluid retention, or a chronic cough, or wheezing, or a skin rash, right? So all of these may be signs of inflammation in the body.
Your gums are a big indicator.
And then weight around the belly. So one of the areas that's been the most researched with cancer, and especially with breast cancer, but lots of different cancers, is insulin resistance. And so insulin resistance is just that pre-diabetes condition where your blood sugar might be okay or just starting to go a little bit high, but your body's making a lot of insulin to keep it that way. And that high level of insulin creates a lot of inflammation for the body, and it causes us to gain weight around the belly. And we know that that's an area that we can really influence with lifestyle.
Right. And so what's happening over there, ladies? Oh, we get a little spill. That's okay. That's all right, just leave it. Okay, all good. Okay, so lifestyle.
Yeah.
What are the really important to, super up there?
So really, keeping a lot of lean muscle mass, right? So one of the things that happens is we lose lean muscle mass if we don't work hard at it. They say after the age of 25, our lean muscle mass just goes down if we're not working really hard against it. And that's one of the things that I see with women, whereas they can make the biggest difference in terms of their insulin sensitivity and in terms of their metabolism, is by maintaining lean muscle mass. So with resistance exercise, whether it's strength training or Pilates with a reformer or your own body weight, maintaining your lean muscle mass is one of the best things we can do to keep our insulin working well in our body. And what insulin is that hormone that responds to the food that you eat. And so you want the insulin to work quickly, but not get too high, essentially. So strength training, resistance exercise, keeping your lean muscle mass strong. And so often we're so focused on pounds on the scale, and that it, kind of gets us derailed from really what is important in terms of our health. And so that's like probably my number one, from a diet perspective, avoiding the refined carbohydrates, things with a lot of added sugar.
Okay, so wait, hold on. So refined carbohydrates. So what would that be? Like a pasta?
Yep.
Okay.
Yep.
So,
pasta,
and
bread,
does whole
crackers,
wheat pasta,
cookies.
Does whole wheat pasta better than regular pasta? Not really. It's still going to spike you.
Yeah. So I mean, the amount of carbohydrates somebody can tolerate really depends on their age, the amount of lean muscle mass they have, and how active they are. And so if you are, a 22-year-old man and you're, training for a competition, you can eat a lot more carbohydrates than if I'm a 57-year-old woman who, actually, I do a lot of exercise. So
well, you do. You do. You can eat it. You can eat that bread.
So it really depends on, so refined and processed carbohydrates, right? Anything that has think of it, anything with a flour. I think that's a great way to think about it. Anything that has flour in it. You want it most of the time. It's not like you can never have it, but most of us can't eat enough calories to be able to consume that on a regular basis and not have something get out of balance. And what can get out of balance is you can either put on weight around the belly, right? The whole visceral fat and insulin resistance, or the other thing is that you're eating too much of that, so you're not eating enough vegetables or enough protein or enough healthy fats. And then you get nutritionally deficient in certain things.
Right, and so it's not that vegetables do not have carbs in them.
Absolutely.
It's just that it's healthy carbs, and you want to also balance it with protein, right?
Exactly,
So
and it's
at least
healthier
you're getting,
because it has more
right,
vitamins and minerals and
fiber,
phytonutrients.
fiber.
Oh, my favorite,
right? Fiber, your favorite fiber. Oh yes. So you're wanting to say so. The interesting thing, this is in my spare time, I decided that to take some of the things that we're talking about, because what will happen is that I have a friend that was like, okay, I'm going to have sushi. Okay, and I'm gonna eat a lot of sushi because I don't want to eat fat and I'm trying to be healthy. Sushi rice is loaded with sugar. It's like carbs and it goes flying up, right? So it raises your blood sugar, and here you are. So then you feel defeated because it's like, but wait, I'm eating sushi. How could that be bad for me? So learning kind of what to take out of your diet, what to add, not to feel like you are not having what you want to eat to some degree. But if you look at what your carbs are and what you're eating, that's why it's so important to eat at home as much as you can, because you can look at the diet. So in my spare time, I'm doing like this little show, and I made like a Liz lasagna, actually. It's also part of the Wise and Wonderful Woman channel. But anyway, one of them was lasagna noodles, right? So I was like, let's make a lasagna. 44 grams of carbs in a lasagna noodle. I was able to find heart of palm little sheets that I made a lasagna out of, and it was 4 grams. So I'm still able to put the other stuff that I want into it, but you gotta bring it down because you're spiking your blood sugar, and then it becomes potentially inflammation.
Because when your blood sugar,
cholesterol.
When your blood sugar spikes, then the body has to produce a lot of insulin to process it. And so when your insulin spikes, that is a storage hormone. So high levels of insulin says to the body, put weight around the belly, because that's what insulin does, or put fat in my liver, it's a storage hormone. And so you don't want these big spikes in insulin.
And is it also cancer also feeds on sugar? I mean,
yes.
Because we're talking about the carbs and the sugar, right?
Yeah, all the research has shown that when you have more insulin resistance, you get more many different types of cancer, but including breast cancer, lung, colon, pancreatic. There's lots of them, sorry. So cancer level increases, you have more chance to get another cancer, and then you have, and you don't have as good survival rate. So insulin resistance, pre-diabetes, and then of course diabetes is associated with worse outcomes.
So what are the things that we should be eating in terms of, so when you say like the anti-inflammation diet, what the hell is that? So what are the things that we should introduce or have on a daily basis, or as much as we possibly can stomach, to keep that inflammation down?
Yes, so think about it at every meal. You want to have a good source of protein, a good source of fat, and a lot of fiber. And those three things together help balance your blood sugar. So, you look down at every meal and say, okay, do I have a good source of protein? Bless you. Do I have some healthy fat here? Do I have some fat with this? And do I have a lot of fiber? And that's a great way to start so you can balance your blood sugar. And then of course, my favorite thing to talk about is eating the rainbow, and getting all of those colorful vegetables and plant foods and fruits and spices and teas and coffees every day. So you want to be getting something from every color of the rainbow every day. Some red foods and some naturally orange, yellow, green, blue, purple, red, tan.
So who's feeling a little overwhelmed by that? Just a little bit. No, seriously, because it feels like how am I going to do that? But just think about it in small ways. Like if you have peppers in your refrigerator, like if you're making an egg, just cut and put some vegetables in the egg. Like just be adding things to it. Like when I was making lasagna, put that in there. If you can kind of add things. One of the things that is a sugar bomb is breakfast.
Yeah.
So who starts their day with like a Dannon yogurt, like a yogurt, or nobody in this entire room starts their day with yogurt? Okay. So yogurt typically, what's the good yogurt and what's the not? Because the typical yogurt is like, exactly. 50 grams of sugar. It's a lot of sugar.
You really want to avoid the added sugar yogurt, absolutely. But one of the things that we were talking about, even the acai bowls,
oh
right?
My God,
like you think, acai bowl, that sounds healthy,
like
right?
75 grams of sugar. Like no joke, we did it. We did it. We did a breakfast thing on the show. We're doing all this research, and we're looking like you think you're having a shake, and you go and you have. There's banana, and then you put some like strawberry, and then you put like a protein powder that also has some sugar in it, and then it's just like I'm eating the shell.
And then you get a headache like 30 minutes later, right? Yeah.
Right? It's tough.
Yeah.
So it's not that you shouldn't be having the fruit.
Right.
It's just
that you have to have it in with enough protein and fat,
right,
to balance your blood sugar.
So when you're saying like a healthy fat, so that gets into, again, those of us that have any kind of high cholesterol. It's like, oh my God, I can't have a piece of meat. I can't have, I should be having only tofu. You're not a believer in that. You're a believer in like, there are good nutrients that are in pork or chicken, like not a lot of red meat. I mean, that is.
So the American College of,
somebody.
American Cancer Research. American Cancer Research. Okay. So the recommendation in terms of red meat, like in terms of a cancer perspective, it's like 18 or less ounces a week, and to avoid the processed red meats as much as possible. So that's really, bacon and sausage and salami. Yes.
Like no sausage, no ham.
Well, it's just you still want to eat too much of it, right? Like that the processed red meats are the ones that have gotten they think has more of a connection in terms of cancer risk. And so what people always ask me, they always come in, especially if they've had cancer, and they think, should I be vegan or vegetarian? And I love vegetable proteins. Like I love beans and legumes and nuts and seeds and tofu that is organic and non-GMO, right? I love vegetable proteins. But a lot of times when people go vegan or vegetarian, they sometimes don't get enough protein and they get too many carbohydrates. And so over time, we might see that they start to get the insulin resistance that we know is not good for cancer also. And they also start to become deficient in certain nutrients like B12 and iron and zinc and omega-3s. And so in general, from a protein perspective, I like the balance between the animal and vegetable protein, where you get some of each because they both have benefit for our health. And just not overdoing it in terms of the processed meats.
So the anti-inflammation foods, just in terms of, I know that you were saying,
Yeah.
so mushrooms are great, raw walnuts, fish, salmon especially.
I love salmon.
So about fish, about meat, about eggs, trying to source them properly, because there's a lot of crap in the stuff that we eat. So you do not want to have farmed fish, right?
I mean, it's
As much as you can.
yeah, as much as you can, you know. But I always, but on the other hand, we do have to eat, right? And
Right, and if you're at a restaurant, you don't know where it's coming
right.
from.
But I do like whenever we can, for fish, wild is great, and we want to be organic as much as possible, and we know that can really help from a lot of reasons. And one thing you were saying earlier about preparing your food at home more is great, because we also know when we prepare more of our food at home, we lower our levels of parabens and phthalates, and those are endocrine disrupting chemicals.
And what are those?
Yes, those are
Who
endocrine
knew I was
disrupting
doing that while I was making a little?
endocrine disrupting chemicals, and what that means is that they are substances, these are toxins in our environment that can impact our estrogen receptor in our body.
But why, if we are making food at home, would that be lowering them? Sorry.
No, that's a great question.
There you go.
Because
That's why I'm here.
Because there's a lot of these endocrine disrupting chemicals in packaging. So a lot of packaging, like the plastics and the packaging, will have a lot of these endocrine disrupting chemicals. Is this for me? Thank
Look
you.
at her. Look at her.
Thank you. This is wonderful.
We just love her.
So yeah, are we taking questions or?
No, not yet.
No, I'm sorry, we're not taking questions.
No, not yet, because we will go off track.
So endocrine disrupting chemicals are, other people have, we can call them xenoestrogens. And those are chemicals in our environment that can act on our hormone receptors in our body. And they have been shown to be associated with everything from cancer risk, like breast cancer, uterine cancer, but also our fertility and PCOS and our hormonal balance.
So
Polycystic ovarian syndrome, which is just when women will get irregular periods. So these chemicals in our environment, unfortunately, are impacting us hormonally. And so we do know that when we prepare more whole foods at home, we get exposure to less packaging and plastics, and that is actually a good thing for us.
Right. So bottled water. I mean, it's like I will beg all of you. You can buy a water filter that will go under your sink. You have to spend a little bit of money, but it's under your sink. There's a hole that you have to drill on your counter. Yeah, it is life-changing. And then you should have a stainless steel bottle, right?
Yep, or glass.
Or glass, not aluminum. But when you're
Not
walking
plastic.
around with these plastic bottles, it's bad. It's
and even
really
if they
bad.
say BPA free, you know that what they did is they just changed the molecular structure slightly, so it's a different hard plastic. So it's not really a better choice, probably. So. Right.
Yeah.
They used to always say 7, right?
So in terms of fiber, can you just
Fiber.
yeah? So
Fiber.
okay, so fiber. What kind? So omega-3s are something that's super important for
Lowering inflammation, right?
So
That's why we
omega-3s
love omega-3s.
Omega-3s are, you can take omega-3 supplements. That's the fish oil, right?
Yep.
Walnuts, we talked about salmon.
Yep.
What other things should we be having?
So ground flaxseed is a wonderful fiber source and a source of omega-3 fats. So ground flaxseed is great. You can put it on, on your no sugar added yogurt with walnuts and a few berries, right? Like that's a great way to use it. Or you can put it on a soup or on a salad. Ground flaxseed is a great source of omega-3 fats and a great source of fiber. And we know that fiber is great for us for lots of reasons. One is that it helps us balance our blood sugar. So when you eat a meal that has a lot of fiber in it, your blood sugar doesn't spike as much after that meal as if there wasn't as much fiber in it, right? The other reason fiber is so good for us is it feeds all the healthy microbes in our gut. And we know that these bugs in our gut are really influencing our overall health in our body. So like we know that when we have the right balance of good bacteria in our digestive tract, we are healthier. So fiber is the prebiotic that feeds the probiotics or the bugs in your gut, the healthy ones. So that's another reason. And then the third reason fiber is good is because it binds to toxins and then it pulls them out when you poop.
There you go.
Yeah.
There you go. So when you're looking at labels, you want to make sure that. So when just give us a little blurb on process. We're not supposed to be having as little as possible processed foods. So tell me, like, what is a processed food? You're saying things that have flour are more kind of carbs and are going to raise our blood sugar. Yeah. But processed foods like.
Yeah, we want to avoid, and most,
packaging.
We really want to avoid a lot of ultra processed food, right? And so
that would be like what? Like,
yeah, I mean, really like 3/4 of the grocery store, all right? Like where we've really just,
even some crackers. Like you look at a normal cracker, there could be a cracker that has like flour and some sea salt and a little bit of olive oil, right? And then there's another cracker that has like 14 different things and trans fats and everything. Actually, let me ask you a question about trans fats. So one of the, something that's the seed oil. Seed oil has been getting a bad rap. So when you are eating, you want to try to have healthy oils like olive oil.
Olive oil, and like to get an organic extra virgin olive oil is a great oil to
avocado.
use. Yep, avocado oil is
sesame
lovely.
oil good too?
Sesame oil can be fine, absolutely.
Okay.
It's the reason that seed oils have gotten a bad rap, like canola, and a lot of processing has to go in to pull out a lot of the oil from some of those. And so, you just want to think about as you're getting as close to the source of the food and not being as, so it's not as processed. And whenever food is processed or ultra processed, there's a lot of things that are pulled out of it from a nutrient perspective and a lot of things that are added to it from a preservative perspective. And all of those things, so as much as we get toward the, what came out of the ground or was caught, right? We want to get as close to that as possible.
Right. So when I was thinking I was having, this is a perfect example where you think, okay, I'm going to have hummus, right? Because it's chickpeas and that's awesome. But then all of a sudden I realized that the hummus that I was having had a bunch of canola oil, and I could tell only because I saw when it was in the refrigerator, it looked weird. Yep. And I had garbanzo beans or chickpeas ground up, and I'd done it myself with olive oil. It looked different. It was like the canola oil just looked like it would stick in my arteries. But read if you are having packaged, try to make it as much as you can. You can make hummus in 2 seconds, actually. But look at the labels, because when you go to Naya, the baba ganoush has olive oil. But the hummus has canola oil and a whole bunch of other things in it. But you have to just take responsibility for what you're putting in your mouth, because it affects you.
Have you done the hummus on your cooking show yet?
Yes, I have, and it got like 9,000 views. As a matter of fact, yes, it did.
Oh, nice.
It took like 2 seconds. But it really, it's simple.
Good.
It's simple.
Yes.
But anyway, we're going to take some questions, but I want, so what are the things that we should not be having? You're going to read the labels on how many carbs, and also the amount of sugar.
Added sugar, you want to avoid added sugar,
and
right?
the sodium, because sodium can be like crazy high. I don't have to watch my
you know
sodium
what I
so
always
high, but-
say? I always say avoid labels, like as much as you can, you know? I mean, it doesn't mean you can never eat a food that has a label, because some things do, but you want most of your food to not have labels. You want most of your food to be the vegetables that you know, that don't have a label, and your fish and your meat and your beans that you don't really have a label, right? I mean, so you want to stay away from those. I think that's like the easiest way to go.
And eggs are not a bad thing, but I just, you know, in terms of reading the labels on the eggs, it's like, we just did this whole thing about like, that like cage-free. Cage-free, all it means is that they go from one jammed dark house with no light, they have a little opening, and then they can go to like another room that doesn't have a cage that still is dark and nasty. It's not free range. Free range does not, it's pasture. It has to be in a pasture. They also get a massage and a little manicure, pedicure. But anyway, I swear the whole label was just like, it's taken care of by somebody that's nice. They talk to them. There's a therapy every Friday. But anyway, it's fine. It'll cost you like $3 more. But you can see the difference because there's a chicken stress hormone. These chickens are stressed out, and they are releasing, not only are they eating shit because they're eating hormones and they're not eating organic stuff, but then they're eating stuff that you're gonna be eating, and they're having the equivalent to the cortisol, which is the hormone that you're releasing in your body that's not great, and they're releasing it as the chicken equivalent, which I forget the name of it is. So anyway, want our pasture-raised eggs. Anyway, sorry. Is there anything you want to end with? Because there's ladies that are going to be asking some questions, but we got 5 minutes to do that because my team has got to get home.
So, you know, I think it's important to look at that individual person and what is coming in to see you and where do they need to change and make shifts to get to their optimal health. And that's what we tried to do with this book. So you can kind of figure out, okay, for me, and then, so for me, right, I realized that, okay, I had my nutrition and exercise down, but I didn't have my stress management down, right? And I had to really work on that. And I spent a lot of time really working on that. Or like with the systems in the body, we talk about, well, you know, do I have to pay attention to what kind of toxins do I have to eliminate? Or is my microbiome need support? Or is there inflammation or insulin resistance? And those are all the areas you want to think about. And then think about for you as an individual, where do you need to focus so you can get toward your optimal health?
So who was here in January with Bob Roth and Transcendental Meditation? I know a bunch of you have been starting to do it. It's life-changing meditation. I mean, it's not, are you a big believer?
A huge believer, absolutely.
There's brain changes. They're legit. Mm-hmm. It really makes a difference. It's not just so that you can be nicer to your spouse. It's or your coworkers. It really makes a big impact to your body.
It feels better.
Yeah.
It just feels better minute to minute, right?
Right. So there's the meditation, sleep. We have to end with sleep.
Mm-hmm. Yeah, sleep and rest. I think sleep and rest are really, really important. You know, giving your body time to rest and getting enough sleep. Now, people always get concerned when I say sleep's really important because then they be like, I can't sleep anymore, and that, you know. So, you know, we don't want to be focused so much on our sleep that we're getting worse sleep.
Stressed out.
We're so stressed that we can't sleep.
To be able to sleep better, but
it really happens with sleep. Oh my goodness. Right. We start thinking about how we're not sleeping and then it's a mess. So I like to put sleep and rest in the category together. You just need to give yourself time enough so your body can chill out and kind of wind down, and getting time for rest in your day, and then allowing your body to sleep, you know, is very important.
I mean, the most important thing is that you're focusing on, and which is so important, about prevention. Mm-hmm. Right? It's about just trying not to get sick. And when you are sick or you have something that is a symptom, is to be able to get your body as healthy as possible so that you can heal yourself, right? Because there's incredible power in our bodies to heal ourselves.
The body has a tremendous ability to heal when we put it in the right place, right? When we give it what it needs, so it can heal. And I think each of us, we sometimes know what we need to do to help our body feel better. But a lot of times we kind of, close our eyes to that. Like for me, you kind of I'm going to focus on the nutrition and the exercise, but really what I need to focus on is the stress management, right? So you really want to think about, okay, where do I need to focus for myself?
Okay, we're going to have whoa, okay, all right. We can't take a ton of questions just because we do have to get out of here. So I don't know how I'm going to let you choose.
I know you had your hand up for a long time.
My question is this, how does one test for insulin resistance, and is that a leading indicator of inflammation?
Yes, so yes, insulin resistance is one of the leading causes of systemic inflammation in the body. Yes, absolutely.
So that and the CP, what is it?
Yeah, it causes you to gain weight around the belly, and it causes your CRP to go up. Yeah, so
what are you
how do you
testing?
test for it? So you can ask your doctor to test a fasting insulin and a fasting blood sugar, but sometimes the fasting blood sugar looks fine for a long time, but that fasting insulin is going up. The research says that greater than 10 for a fasting insulin is too much. It's showing signs of insulin resistance. I like it around 5 or 6. But definitely greater than 10 is a concern that you want to work on reversing the insulin resistance. You also can get a sense of insulin resistance, and I do talk about this in the book. You'll see in the section, there's a section on what tests you should do, ask your doctor to do, and all that. But you can get a sense of insulin resistance with your cholesterol because insulin resistance will cause your triglycerides to go up, will cause your HDL to go down, and it will cause your cholesterol to become smaller and denser. And so if you do particle size testing of your cholesterol, it'll look a certain way. So there are some other things. And CRP is a marker for inflammation that you can ask your doctor to do too.
Awesome. Okay.
Yes.
So I'm a breast cancer survivor. I had estrogen-driven cancer after 5 years after I tried to get pregnant. So when I went for fertility treatments, they never really even talked about that.
Mm-hmm.
So I wasn't able to get pregnant, and then 5 years later I had the breast cancer, which luckily I didn't have to do chemo, I just had radiation, and everything's been okay. But I was interested in the QT imaging that you were talking about.
Yes.
Is that, I've never even heard of that. Is that something that insurance is paying for, or no, probably?
I don't think insurance is paying for it yet, and they're hard to find. There's not a lot of them. I mean, I know there's one in Philly, I think, and there might be another one in New York somewhere, but I'm not 100% sure. But if you just type in QT imaging, they have a place on their website for find a location near you.
Right now, I'm just getting like the ultrasound, the mammogram ultrasound once a year.
Yep.
MRI, get an MRI.
Yeah, I mean, for some people, MRI is recommended, but it's not. You really definitely need to talk to your doctor about it because not everybody can get it, and so it's may not be appropriate for everybody.
Does QT imaging differ from a mammogram, a sonogram, and an MRI?
So a QT imaging is an ultrasound, but there's not, like when you go get an breast ultrasound now, somebody's in there with you kind of rolling the wand over your breast. With QT imaging, you lay on a table and it does an ultrasound. So it's ultrasound technology, so there's no radiation, but it's not dependent on the technician. So hopefully,
So you're saying that
we're hoping in the future that might be
if they're rolling
more
it on, they
available.
could miss an area, or they're not pushing in deep enough or something. Just a little bit more.
Yes.
Does having medical menopause or early menopause reduce your breast cancer risk?
So we do know that if you start having your period earlier in life, and if you go through menopause later in life, there is a slight increased risk. But I think it might, I don't know, like if you went through early menopause, it probably depends on the reason for why you went through early menopause in terms of the risk. Right, yes, so if you've had your ovaries removed, there is a decreased risk for estrogen receptor positive breast cancer, yes.
I talked to and they recommended before my
Right, exactly.
my menopause to take my ovaries out.
Yep.
Like an 80% chance to 40%.
Yes.
Okay,
Yes.
one more question. Ellen?
I was fortunate that my gynecologist always insisted that I do a mammo and sono together, always, and this was in 2000, whatever, early 2000s. I ended up having a mammogram, no cancer, sonogram, cancer. So
Whoa,
I'm grateful
really?
that it was caught early. And the question I had is, are you familiar with the Abascal Way to Quiet Inflammation? It's a book that talks about inflammation and how to eat so that you limit.
What is the name of it?
Abascal?
A-B-A-S-C-A-L, Abascal Way, that's the author.
Oh,
And
that's,
I have a friend who deals with inflammation, and she's been following this diet, and it's really helped
huh.
reduce. I just wondered if you'd heard of it.
I don't know if I've heard of that. You know, some people, what we do a lot to help lower inflammation in the body is sometimes we'll do like elimination diets, so pulling away inflammatory foods, and pulling away the refined and processed carbs like we were talking about, and then looking for imbalances or any sort of low-grade inflammation, low-grade infection in the body. So like we were talking about the gum inflammation, dysbiosis in the gut, imbalances in the microbiome.
Sinus infections, right?
Sinus infections, yeah, that can just create this kind of continued inflammation. Yeah.
I wish that every doctor could be like you. I mean, really. I mean, no, seriously, because you come from a place of compassion, of knowledge. You're not trying to dumb things down, but you're giving us the information. And we're just so lucky to have had you here. If anybody, it's life-changing to go to her workshop. I think you do them in January, October, and April?
This year, for 2026, I'm going to be at Kripalu doing Building a Better Immune System, April 17th, that weekend.
And the pipes will not burst
They
because
won't
it's
burst
April.
in April, no, and they've all been fixed, so now you
It's
know.
all good.
And then we're also doing it in October. So a lot of times we do January, October, but this year is April, October.
Okay, I mean, it's really fantastic. You should definitely check it out. But we will also, as we always do, we're going to send out a thank you for coming, and we will have a lot of the different. We'll certainly put your contact information, but a lot of the information that we talked about here. And the book you can get online. They will print it out for you, right? It's like
Yeah. So it's.
If you want to share it with other people.
The Breast Wellness book is an e-book on Amazon, but you can also get it printed on demand.
All right. Well, thank you.
Thanks for having me.
That was awesome. Thank you so much.